Welcome to Health Systems CIO's interview with Erik Decker, Assistant Vice President and Chief Information Security Officer with Intermountain Healthcare. I'm Anthony Guerra, founder and editor-in-chief. Erik, thanks for joining me.
Thanks, Anthony. It's a pleasure to be here.
Great. Let's start off. You want to tell me a little bit about your organization and your role?
Sure. So Intermountain Healthcare is an integrated delivery network located in the Mountain States, based in Utah, but having a presence in 3 surrounding states and really an eight-state strategy. So we're about 25 hospitals. We have one virtual hospital, 11 billion in revenue, 43,000 what we call caregivers. We consider all of our employees to be caregivers and part of the care continuum, and up to 2,800 beds. So, at the end of the day, so we also have a plan, a payer plan called Select Health with a million members in that. And so that's what ultimately the integrated delivery network is all about. Our mission is for Intermountain is to help people live the healthiest lives possible. That is what we focus on. Really, quality care at an appropriate cost is the key thing. So my role as AVP and CISO is to help protect this organization, protect the safety of our patients, in the digital enterprise, the financial assets of the organization, and the privacy and confidentiality, of course, of our patients and our members' private information.
Very good. All right. So what this interview is going to be about, ultimately, is about engagement, and engaging as a healthcare IT security professional, engaging with different organizations, staying aware of best practices. That's ultimately some of the more specifics we're going to talk about. But I want to talk about a little bit, establish a little background with you first. You've always been pretty involved with a lot of different groups, volunteering your time, your energies to engage and to help formulate different pieces of information that can help others do their job better. Where did that come from? Have you always done that? Did something sort of wake you up to that at some point and you kicked it into high gear? Tell me about that, and then tell me a little bit, if you want to go into specifics, about some of the main groups that you've been involved with.
Sure. Yeah, this is cybersecurity is kind of one of those things where we only do better when we're all doing better. So we all have to be in this game. We all have to be protecting our assets and our people. And when one of us fails, the sort of the weak link in the chain kind of concept, when one of us fails, then we can have catastrophic consequences across the board. So and it's also something that's not really a competitive advantage. Like when I talk to my fellow CISOs that are out there, we openly share our tactics and techniques, because the mission of what we're trying to do is noble. We're trying to help people. It's not about bottom line, that kind of stuff. So, there's a part of me that's just sort of always been that way. I learn best when I talk to my peers and I talk to other people. I like to hear what the other people who've already gone through some challenges and learned, gotten some of the bumps and bruises, and can help me, on that path. So I've always felt that it's best to have a good network and a good community to share that stuff with. So it was kind of natural when, I think probably the impetus was in 2014 when I joined University of Chicago Medicine as their first CISO. My old boss, Eriks Role, who's a fantastic mentor of mine, he really introduced me to some associations and said, "Hey, get out there and try to do some good, and we'll support you in the process of doing that." And also it kind of around that time, and we're still in this time right now, the whole healthcare cybersecurity problem is still in its forming, and we gotta solve for this phase. We're not in the beginnings of it now. We've actually made significant progress over the last 5 years. But I saw that opportunity as well as like, hey, there's not a lot of solutions at a national level, at a global industry level, at those kinds of things. There's not a lot of solutions that are out there. So it's ripe for opportunity. It's ripe for making a mark, for being able to lean in and try to do some good. And honestly, that drove me. So it truly is a second job. There's a lot of work that goes into all the outside stuff that I do. So just to kind of give some examples of this, obviously there's a lot of associations that are out there that people can get involved in, and they should. There are professional organizations within the cybersecurity community that are cross industry. There's a lot of really good ones that are out there. Highly encourage folks to participate in those. That's where you can find good networks of common people and see how the problems are similar or dissimilar. And then within healthcare alone, there's obviously also specific, trade associations and things like that you can get involved in. So that's a great place. The work that I do, I'm involved in those. And then I'm also, the work that I do is part of the government public-private partnership. So there's it formed back, actually, I can't quite remember exactly when it formed. It might have been 2007, 2008 or sometime around that time. A presidential directive pulled together and identified 16 critical infrastructure across the country. These are critical infrastructure that are run by private industry, but have there's a national public safety, national interest in making sure that is run appropriately. So these critical infrastructure come together with a government counterpart and an industry counterpart. There's an all hazards version of this, which is, the environmentals, the physical threat, the, cyber threat, all those things sort of meshing together. And that comes together in these things called the SCC, Sector Coordinating Council, and GCC, Government Coordinating Council. Then what I'm involved in is there's the healthcare version of that. There's things like finance, oil and gas, energy, et cetera, transportation. These are all part of the 16 critical infrastructure. So the one I'm involved in is the healthcare sector coordinating council, government coordinating council. The one that deals at the all hands, I'm a co-chair for that. Below there is a group called the Cyber Working Group. And when the Cyber Working Group works with the government, it's called the Joint Cyber Working Group. Joint because it's government. So I helped establish the latest iteration of that group back in, I want to say 2000. I'm losing my time. It's like 2017, 2018 timeframe. Helped lead the rechartering of that. There's a new executive director that got put in charge of that group, and we went from pretty nascent organization of maybe like 30 organizations that were part of it, and maybe 50 or so members, to today we're at 300 organizations that are members of that, and up to over 700 actual individuals that are part of it. So with that, there's an election process. I served on the executive council of that for 3 years. I just rolled off of that last December, and I was elected as the chairman of the Cyber Working Group for the next 2 years. And in that group, what we do is we have 15 task groups where we organize, and we're building content. We're building resources, practices, methodologies, et cetera, that help sort of set the stage for what we should be doing in cyber and healthcare. And there's lots of course different facets to these problems, and which is the reason why there's 15 task groups. And then the last piece of this, I know this is so much, but the last piece of this is one of those task groups that's in there is the 405D task group. Mm-hmm. And that task group is the one that I run with my government counterpart, Julie Chua, within Health and Human Services. And what we do there, the inaugural publication that we created there was the Health Industry Cybersecurity Practices, or HICCUP. We posited 5 threats that everybody faces and 10 practices to mitigate them, 89 sub-practices to get into the specifics. And then we stratified that by if you're a small, medium, or large. So we wrote you essentially a guide, based on the size of your organization. And then just last year, January 5th, there is a new law that was put into effect. This is something that I worked on with Chime back in 2017, 2018. That instructs OCR, if organizations have adopted what's called recognized cybersecurity practices, it instructs OCR to offer relief in the case of a breach. And so we helped sort of set the stage for that. And 405D is specifically called out in that law as a recognized cybersecurity practice. So it's pretty awesome, to sort of see the genesis of all of this kind of go from the beginning to where we are now. On my journey, I've testified to Congress. I've been invited there to serve as an expert witness. I've testified, at a couple of other forums as well. And it's just been awesome, so.
You mentioned relief, specifically, what gets you the relief? If
So
you've
if you
done certain
have,
things?
yeah, if you have adopted recognized cybersecurity practices. And so the definition of a recognized cybersecurity practice is NIST publications, and the NIST, like the NIST cybersecurity framework and things, along those lines, which is great. Or anything promulgated under the 405D program. So HICCUP is a recognized cybersecurity practice. And then there's another category of others that has yet to be defined. OCR has not put out their RFI and their notice for proposed rulemaking yet on this new law, but there will be more specificity that comes once they do that.
All right, very good. So as you're talking about this stuff, I'm thinking that there's 2 types of security executives out there in healthcare. There's the type that just want to know what's going on. They want to know the output of these entities. Health system CIO is certainly interested in helping you with that, as we're doing right now on this call. So let's talk about the people that they don't want to participate. They just want to know. So where do they go to get the best information that you're working on?
Yeah.
Where do you want them to go to get this stuff?
Yeah. So we just launched a new website within the 405D program. It's 405d.hhs.gov. So go there. We've got tons of, HICCUP was the inaugural publication, but we've created all kinds of different supplemental materials as well. So as an example, we built a threat to practice matrix that helps organizations sort of tease these things out. So say you're worried about ransomware, which is one of the 5 threats. Well, we've identified the exact practices that will directly impact and help mitigate that ransomware threat. We've also identified indirect practices that'll help do that. So you can sort of, there's 89 things. That's a lot to look at. Just pick ransomware, go right to it, and check yourself and see how you're doing against those items. So that's one website. And if you want to join the 405D program, there's actually an application process on that page. The other page that I would suggest is 2 more, is the Health Sector Coordinating Council.org. So that's the cyber working group level. So all those 15 task groups and everything that I talked about, that gets you into that space. And you can see, who the executive council is, the 7 subsectors, the task groups, what we're working on, the publications that have been produced there. There's things like the HICS Scrim, which is a supply chain risk management guide. There's workforce development. There's information sharing. There's all kinds of good stuff up there too. And then the last place I would suggest people go, especially if you're looking for just, free resources, to free services, frankly, that you can use that are supported by taxpayer funding. Go to CISA's website, the Cybersecurity and Infrastructure Security Agency under the Department of Homeland Security. They have a whole series of services. So they will do phishing tests for you. They will do external vulnerability scanning. They will do penetration testing. They will do tabletop exercises. And there's a number of other ones as well. And that's a fantastic resource for anybody to use. and CISA does prioritize those in the critical infrastructure when it comes down to if there's too much demand for the services on using it.
All right, so that's good information for those who just want to know. What about those who want to do, those who want to
Yeah.
participate in some of this stuff? What would you say to them?
I'd say, you get two avenues. I mean, it's all really the same avenue. I mean, join the Health Sector Coordinating Council. If you're a practitioner in healthcare, meaning that, you're running provider, plan, pharma, medical supplies, health information IT is also part of those subsectors, labs, critical access hospitals, nursing homes, anybody who's in the continuum of care can join. If you're an association that directly supports those folks, you can join. Because we like to think of the cyber working group as the association of associations. I mean, we have a lot of the big name associations that are in there: the AHA, the AMA, HIMSS, Chime. I mean, these are all like the premier dominant groups, and this is sort of where we come together to sort of talk through and work through the challenges. We do allow some vendors in. We have a cap on how much we do that. We know that vendors obviously support our industry and many other critical infrastructure industries. And when vendors are there to give back and not business develop, we absolutely have a zero tolerance policy on that. We will, we'll consider it, but they're not voting members. They are advisors when they come in.
Right.
So if you go to that website, healthsectorcoordinatingcouncil.org, there's I think an email address that you can email off to suggest if you'd like to join it. The other thing you could do, if you're specifically interested in the 405D program, you can go off to that 405D website, and we've got a form there where you can submit an application to join that group as well. If you join 405D, you join the cyber working group. It's just by default, it happens. 405D is it's just also a big group. I mean, we have like over 100 or so, about almost a third of the cyber working group is in the 405D group. So.
Okay, very good. So we talked about for folks who want to get involved, you mentioned, and we laughed, that this can be like a second job.
Oh yeah.
Right. So, well, let's say, you want to do it. You know it's going to be a lot of work. You want to do it. Now, any CEOs who hear a joke like that might say, hey, I don't want my CISO off running around doing a second job. So my question to you is, if you are a CISO and you do want to participate in some of the stuff, you do want to help, but you don't have a boss like Eric Blanca, who you said was very supportive. You have someone who's less supportive, let's just put it that way, about you sees it as not part of your job. This is extra. What advice could you give to them about how maybe to convince that person that this is worthwhile?
Well, yeah, I mean, I can also say, the level of participation is yours to define. I mean, you can join this group and serve as, just an advocate for the stuff that comes out. You can be a voice amplifier if you want, just part of a community listening in. And it's no different than participating in any other trade association, to be frank. I mean, the amount of time that would be required is not much. The level of involvement and recognition and all that, of course, corresponds to the amount of time and effort that you give into it. So there's that. I mean, if you just want to dip your toes in and sort of see how it comes together, you could do that. There's those other types of roles that we have. And it also depends on the task group that you join, because the dynamics of those task groups will be different by the leader of that task group. There's always a lead over it. But something as simple as, you just want to provide, feedback and response to some content that has been developed by the task group. You're just a vehicle to run some ideas by. So that's a possible suggestion. You can be somebody who just wants to contribute, to a small section of a document, and just give some content and something that you care really passionate about, one particular focus. And you want to, drive some content in there, you can do that. And then now you're getting into sort of authorship, areas. The part where the work gets really heavy is when you start leading these efforts, when you start becoming like a primary author of these documents. And then as you go into the chain of, of leadership, like when you start getting involved in the executive council, chairmanship. I mean, I meet with the federal government and folks 3 times a week, every week. So there's a lot of time there that is given. But it all goes back to where, you make some fantastic contacts. Your organization reaps those benefits. I mean, it absolutely does. There's a name recognition that comes along with this, where if your organization is behind it, and Intermountain is 100% behind it, which I love, you can help further the brand of your organization by showing that you're giving back and caring about something that actually helps people's lives,
Right.
So there's a good, it's just good work, I mean, it's good, like soul giving work.
Right. So there's that issue of hopefully having support from your CEO to go out and do this. Then there's another reluctance that I've seen. I certainly request a lot of interviews with CISOs, get
Yeah.
some of them, but I would say it's a smaller percentage than I'd like. I think with the security role, perhaps there's a bit of a reluctance sometimes. It could be, I don't know if it's the personality of the type of person who often goes into security, or the fact that they feel like getting in front of the public in any way makes them a target, if they're
Right.
afraid they're going to say something that will reveal something. But there's ways you can have a discussion and help your peers without revealing any vulnerabilities, right? And
That's
then I
correct.
think you also mentioned to me when we talked earlier that there are forums where it is private and where that information will not be public. So if you could address those 2 areas, one is speaking to the press as a CISO and doing it in a way that is appropriate, and then those other forums for where you want to divulge more
Yeah.
details, maybe to get help.
Yeah, I mean, this is a delicate balance, and one that you've got to be careful about, of course. I mean, everything you just said there about not divulging the inside inner secrets of your organization is absolutely correct. And I never do that. If press asks me, at Intermountain, what is your problem in this space? I will say, sorry, I'm not going to talk to you about that. And it's
and be
happened,
and be specific. Tell me and be very specific.
yeah, it's happened. So I mean, you gotta, but what you can do is, again, if you're connected into a large community, you're in these groups, and you hear the themes of what is happening sort of in our industry across the spectrum. We can talk about the themes of challenges. I mean, that is not stuff that is of any surprise. I mean, it's already out there. There's already press around it. But you can be a thought leader in how you can actually try to solve those issues, how you can give people guidance around, tackling some challenges. When you talk to the press, I keep it high level, and I talk about this as themes. I always put my hat on as chairman of the cyber working group when we start getting into what are the challenges in this space or that space, or what have you. The private forums, I mean, things like HISAC, the Health ISAC is a place where not only is it a vetted, private community where you can talk about the very specific things that are going on, but it's also protected under law. So when we have, the Cybersecurity Act of 2015, the same thing that instantiated 405D, that's where 405D came from, was that law. There's a protection mechanism that allows us to share cybersecurity, very secret, very specific, cybersecurity issues with the federal government and, within our ISACs and so forth, that protects it. So if you're talking about a compromise that you've had on your network and you need to reach out to somebody, hey, have you seen these IOCs and these tactics and these things? There's a forum where all of that is happening. And it's very valuable. I mean, the adversaries have a lot of resources. The adversaries, they only have to figure out one way in, to an organization. And we've got a million ways that we're trying to keep our eyes on. So we're always on our heels, on the sense of what's the next attack pathway. And if an organization tries to tackle that by themselves, they're going to be challenged at doing that. But when you share it as a community, you have a lot better chance of staying ahead and responding to these attacks when they come in and getting to it quickly.
So would you say that probably any security executives that don't continually work to absorb information that's put out there about threat intelligence through any kind, if you're not doing that,
Yeah.
would you be very surprised that there are executives that are not doing that, or would that not surprise you?
I mean, there's not a lot that surprises me
Yeah.
anymore. I will say, if you want an effective program, you have to be on top of this.
Hmm.
You
Hmm.
have to be thinking, and there's all kinds of ways that this information comes out. So joining the ISACs, joining Health ISAC, I mean, it does come with a membership cost, but they graduate that membership fee based on the size of your organization. So what Intermountain pays isn't the same as like a medical group, the other thing is like, again, our federal government and critical infrastructure, there's a lot of work that where there's different types of flashes that come out. So the FBI, DHS, within HHS, there's a group called HC3, which is kind of like another watch group for threats. They produce intelligence and flashes. Keep your eyes out for those. If HHS or the FBI rings the bell and says, "Hey, we've got a huge problem on our hands," pay attention. I mean, that's like Log4j that
Yeah.
happened last Christmas. We saw the early phases of that thing, and I was making calls within 24 hours of seeing how bad this thing was, calling my federal partners, calling some of the trade associations and saying, "Guys, this one's like WannaCry, this one's bad," so, and very quickly, there were alerts and things like that were going out, and the industry responded, and it responded fast.
Yeah. Anything more you want to say about the HSCC? I know you feel that's a perhaps not as well known as it should be, but very important.
Yeah. I mean, look it up. The Health Sector Coordinating Council. That's where the critical infrastructure comes together with government. It's not really well known, but it's getting there. We're getting our name out.
Mm-hmm.
And I just frankly, I mean, and again, I'll say it one more time. If you implement the practices of some of these things that we produce out of that working group, you get relief under enforcement. I mean, there is a financial impetus for you to care about what's going on from these groups.
All right, Eric, I think that's about all we had time for. Any final word, or you think we covered it?
I think we covered it.
All right, my friend, listen, great stuff. I think this is going to be valuable. And again, we'll get this out there, open some eyes, and maybe there'll be some inquiries about participation. So very good to talk to you, and hope to speak to you again soon.
Thanks, Andy.